In this video, I will guide you through how you can increase your supplement dosage, also known as titration, and how advanced techniques like pulse method work so much better. I bet you have noticed that all your supplement packagings, bottles comes with this recommended daily intake. In short, they put it as RDI. But have you ever wondered if this RDI applies the same for everyone? Let's say if someone who is a marathon runner in his mid-20s or someone who is working in an office desk-bound in her 40s, or maybe if a retiree in her 70s doing some basic gardening once in a while. Does the RDI on the bottle for the supplements applies to all these three peoples? There's actually quite a lot of factors that you need to put into consideration. One of it is your sex. If you're someone who is male or female, there's a difference. And when it comes to male and female, there's also physics that you need to consider. There's also your weight and your physical activity. Who is a very active person and a non-active person, sedentary or at home, is very different. And most important is their nutrition intake. And if you go much deeper, you might also want to consider your genetic profile. Or if you are someone having these underlying issues, such as your insulin resistance, or maybe you are diabetes, or some other chronic disease you might have. The RDI is somehow much like a reference or a guide for you. It doesn't mean that you have to follow exactly to the dosage they actually recommend. Someone who is very sensitive to a particular supplement might need even lesser dosage, such as a 1/8 of it or 1/16 of a tablet. Or someone who is very insensitive or maybe resistant, I should say, they might need even more. Instead of taking one capsule, they might need like 1.5 to 2 capsules. If you're someone who is having an excess of these minerals, you might need lesser, or maybe you should even stop consuming them for a while. When you are going for these lesser supplements or more supplements dosage, the lower and higher dose, that's when the titration comes in, or even the pulse method. I've come up with a simple dosage sample that requires something like take 2 capsules 3 times daily after a meal, or maybe just with water. When there's a circle around it, that means you take a dose. When there's a cross, you mean you are not taking it. Always remember that when you are trying out new supplements, you should always try one at a time. If you're buying 3 or 4 supplements at one go, you won't want to go all supplements at one go, because when things happen, when there's side effects or adverse reactions, you won't know which of the supplements is causing you these symptoms. And if you are someone who is very sensitive, let's say if you're having these mold issues, you might be very reactive to a certain particular supplements. So you have to reduce or maybe just try out with the smallest dosage. You may even want to open up the capsule and just sprinkle over your food and consume them. You do not want to take the exact 1 capsules, the full dosage, which might have these adverse reactions to your body. Then you also have to come up with a tracking journal. The tracking journal is very useful, in my opinion. You have to track how much you actually consume them on a daily basis. Then what's your increment looks like. You might start with 1/8 of a dosage. Then you slowly increase to 1/4 of the dosage the following day. Then you eventually go to a half a dosage on the 3rd day. Eventually, you will reach your maximum dosage when you actually monitor your own health. You'll monitor how you feel. Then you put everything into this tracking journal. Then at any point of time, if you feel these adverse reactions or slight unusual symptoms you experience after taking the supplements, then you should actually back up a little bit, back down 1 step behind. Then you monitor with the use of the tracking journal, you monitor your symptoms, these reactions for the next maybe 48 to 72 hours. For the second method, pulse method, I got to know this from Dr. Ben Lynch. You can get more info from his book Dirty Genes, which I will leave down a link in my description box below. The pulse method actually enables you to figure out when you should actually stay on the supplements, or when you should skip a dose or reduce a dose, or maybe even completely stop taking them. Let me give you an example how Dr. Ben Lynch mentioned in his book. Let's say I'm taking a supplemental form of tyrosine, which is a form of amino acids. Okay, this amino acid is actually a precursor of the production of the brain chemical or neurotransmitter called dopamine. And the reason I'm taking this supplemental form of tyrosine is because I have a fast COMT. So I tend to burn this neurotransmitter very fast. In order for me to produce more of this dopamine to keep me focused and perform at work, I need to consume a very high protein diet or to supplement with this tyrosine. With titration taken in place, I might feel good after taking one capsule. I might be thinking that if one capsule is making me feel so great, I might have even more. I might go for another second capsule. So when you overconsume it, now these brain chemicals, dopamine, is an excess inside your body. You can't excrete that fast. So when you have this too much of these brain chemicals, you will feel very irritated. You have these hair trigger issues. You find yourself very hard to wind down at night. You have this over fidgeting, and you tend to talk a lot without you noticing it. So by utilizing the pulse method, you can actually understand why you should actually continue the dosage, stop the dosage, or skip a dosage when you feel there's these adverse reactions. Then you use them again when you really need it. And if you ignore all these adverse reactions and you do not consider about the supplements you're taking that gives you these side effects, now they begin to do you harm. Okay, that's it for today's video. The summary of this video is about how you can actually change your dosage of your supplements. You can actually increase, decrease, skip, or even completely stop taking the supplements for a while. If you like this video, and if you want to know more other health related videos, you may want to check out this playlist over here.